Welcome everyone. How are you all? I'm Victoria from Get the Gloss, and welcome to this masterclass with Tolpa and Dr Alia Ahmed, who is a specialist in psychodermatology. We've never had a psychodermatologist on one of our masterclasses before, so it's wonderful to meet you, Alia. How are you?
Fine, thank you, and thanks for allowing me to be part of this brilliant masterclass series that you have here.
Oh wow! Well, welcome, and welcome to everybody who's joined. Just a bit of housekeeping about what we'll be doing this evening. Obviously, you're here to learn all about, to understand more about acne. It's a condition that I know, Alia, you're seeing a lot more of in teenagers and also in sort of female adult acne. There is a strong connection between the skin and the mind, and we'll be finding out a lot more about that. So we'll be talking a bit about that. We will also be learning how to build a skincare routine for an acne-prone skin. So, Alia, can you tell us a little bit about what you do and what is psychodermatology?
Sure. So I'm a consultant dermatologist, and I have a special interest in the psychological impact of having skin conditions, and this is otherwise known as psychodermatology. So psychodermatology is really about the connection between the mind and the skin. So it's the part of dermatology that acknowledges that. And what that means in practical terms is when I see someone who has a skin concern or a skin problem, I'm not only thinking about the treatment that they need for their skin, I'm also thinking about them holistically. So what about their diet? What about their lifestyle? What are their stress levels? What has changed in their life recently? So it's more of an approach that acknowledges that you're not just your skin, and skin is a bit of everything. And we like to tackle all of those areas to give you the best possible outcomes for your skin.
Brilliant. I would love to hear from you guys on the masterclass tonight who can see that they experience changes in their skin when their stress levels or their lifestyle changes. I think probably most of us have seen something happen over the past 18 months with the pandemic. Have you noticed that?
Definitely. I have had lots of patients that will come and see me, or clients that will come and see me with new concerns about their skin, which probably are related to the stress that they've been in, the changes that they've had to become accustomed to. And also now we have different parts of regimes now. So we didn't used to wear face masks, but we do wear them now, and we're changing environments, going from maybe where you may have started working from home. Now people are going back into work, and that's causing some skin related anxiety. So there's definitely been an upscale in the people that we're seeing.
Yeah, and it couldn't be more timely, really, because I hope most of you have received your goodie bags by now from Tolpa. So we're here also to learn a little bit more about this this brand and this particular CBO range, which is targeted towards acne-prone skin. And it's really it's like one of the #1 best-selling skincare brands in Poland, isn't it? It's really cult there, and we're just new to it. So you guys are some of the first people to receive these wonderful products.
Yeah, and I think it's an exciting range. It's got some different ingredients that are still looking to treat acne. And it's nice to see more natural ingredients. And I think lots of people are going towards this sort of natural approach and less harsh feeling ingredients. So I think it's a great range.
Brilliant. We'll be learning a little bit more about that as we go. Do feel free to post your questions in the chat, as I said. As we go, Alia is going to be doing a short presentation, and we can take questions as we go, and there will be time for questions at the end. So Alia, do you want to start us off with learning a bit more about understanding acne?
Sure. So what I'm going to do is, just to make this a little bit easier, I'll be sharing my screen and a short presentation. So I hope everybody will eventually be able to see it. Yeah. Great. So just wait a second for this to go to the
slide. So while you're just sorting that out, as Sylvia's saying, so true, my skin breaks out with wearing a mask, under stress, and also during my period. Yeah, I think we can all sympathize with that. Yeah, I'm sorry to hear that, but yes, you'll come to the right place.
Exactly. And this is all about understanding that link. So we've already talked about me and my special interest in the link between the mind and the skin, and hopefully we'll get to explore that further. And I will be talking about stress during the masterclass today. So anybody that's been feeling stressed and they think it's coming out on their skin, or they can see signs on their skin, please let us know what's been happening using the chat. So main question, what causes acne? And this is something that I get asked a lot. You know, some patient will come in and say, well, what is it that's done this? Is it something I'm eating? Is it what I'm doing? Is it what I'm putting on my face? And the answer is, again, that it's a bit of everything. So what we know about acne is that it needs a few ingredients to make it happen. So you need to have oil on the skin. You also need to have the right bacteria to form a spot. And then both of these together start to clog up pores and form a spot. Also, there are other factors, and these are the factors that we're starting to think about more, and it's really encouraging that people will start to ask these questions. So think pollution, so what we're coming into contact with, the external things that are in our environment, and especially when you're going from working from home, like I mentioned earlier, and back into the working environment for some people. Also your lifestyle, and that does include stress, which I'm going to talk about later, but are you drinking enough water? Are you keeping your skin hydrated enough? Are you protecting your skin enough? Are you getting enough sleep? Even sleep can have outcomes for your skin. If you don't sleep enough, your body perceives you to be stressed, and this is related to acne. Also, yes, there are some genetic links. So there are some conditions that can cause acne. Also, you may be genetically predisposed to have acne, but that doesn't mean that it can't be treated effectively or it can't be managed effectively. In fact, acne is one of the conditions in dermatology which we love treating because we see such good outcomes.
Brilliant. That's
good. And also, it's good to, it's one of the things that, we get really excited. I think, oh, great, it's an acne patient. This is going to go really well. And also hormonal factors. And I'm sure there are people that are listening, and please do comment how you feel your hormones impact your skin. And we know that, for example, progesterone is linked to having acne. Also, if you have rising levels of the female hormone, that can be linked to acne. And usually even around the menopause or perimenopause time, what happens is your female hormones start to decrease and your male hormones, which we all have, they stay high. So that's why older women around the perimenopause and menopausal age can start to get acne. So it almost feels like you're never quite safe from it. But there are ways to get you through these challenges.
I'm interested to know, you say hormonal, and do please everyone, let us know how it's affecting you as well. Round the time of just before your period, you mentioned progesterone. Why do you get these kind of, why here? And why these kind of big volcanic things? I don't get spots any other time apart, and then it's just like really goes for it.
Absolutely. That is actually to do with the concentration of the oil producing glands in the skin. So they're mostly in the central portion of the face. So that's why, and very traditionally, these hormonal type of acne, especially if you're female and you're in the adult age group, we do tend to get it in this sort of U zone. So it's going across your jawline almost. So these are some of the clues that we look for when we're trying to work out if someone's acne is hormonal, because not only do they need adequate acne treatment, we need to maybe start to manage their hormones better, which we do in dermatology now much more often than we used to before.
Interesting. Yeah.
Also, what the other outside or external factor that can exacerbate or affect your acne is the UV. So when our skin becomes damaged by UV rays, then it can start off a process of inflammation, and this can aggravate acne as well. And this all can then become a vicious circle, which is what we're trying to say on this slide. You have the biological side, you have the environmental side, and then one can cause another. And if you don't break that circle, it just keeps going on. And especially when we're going to talk about stress, so I do often say to my clients or patients that stress causes skin disease and skin disease causes stress. So it's important to break that cycle. So this is just about the types of acne, and we'll keep it simple here. So there's not actually a really good grading system, or we don't have a system that everybody uses to say what type of acne someone has, but most commonly we'll simply say it's mild. So that's the first picture, where you have a few blackheads, you will have a few what we call inflammatory papules, so little red spots, a couple of whiteheads, things that go away very quickly. Then the second picture is where these problems start to become more persistent. So more inflammation, more little papules, few more whiteheads, and they're not clearing after a day or so. They're tending to stick around. And the third picture is your more extreme or the more severe acne. And this is where you start to develop nodules. And these are those spots that are really painful and underneath the skin. So you can't, nobody, please don't pick your spots, but I'm sure people do. But they're the ones that you can't quite pop. You know, you'll go for it, but nothing's happening, but your inflammation seems to be getting worse. So those are the ones that are the cysts underneath the skin. Now, I mentioned stress, and I think it's really important for us to talk about stress, especially the environment that we're living and, you know, breathing in at the moment, especially with the pandemic. And what we know is that everybody has a stress axis which starts in the brain. So whenever your body perceives stress, this kicks that axis off and you produce the stress hormone, which is known as cortisol. Now, the thing about cortisol is it has very far-reaching effects in the whole body, not just the skin. It can affect your cardiovascular system. It can affect your endocrine system. So it's not just about stress and skin. It's about stress on your whole body, which is why it's so important to address this. What we tend to see in the skin is that the cortisol hormone is very pro-inflammatory. So what happens is it starts to kickstart inflammation, which you can see in your skin. And also, if you already have an inflammatory skin condition, it can make it worse. Specific to the condition of acne, it can make the oil glands, the sebum producing glands, more work harder. So they are producing more oil, which is what can contribute to breakouts. And also it can affect your skin barrier. And a lot of people are asking a lot more questions about skin barrier. I'd be interested to know if anybody listening has been, you know, thinking about their skin barrier, because historically no one used to ask, but now lots of patients ask, and I love talking about it. You know, your skin is literally like a brick wall. And when the cement in between those bricks starts to, you know, filter away, then that's when all the naughty things get in that cause all these problems, and all the good things like good fats, hydrating properties, all of these go out of your skin. And again, this can affect wound healing. So if you have a spot and it pops or you pick it, then you're a little bit more likely for it to become infected, a little bit more likely for that to take longer to heal. And then because it takes longer to heal, you get left with some pigmentation or a blemish, and then that becomes your sort of permanent reminder of having that spot. So these are the ways that stress can directly impact the skin. And there are lots of studies that show this, also with other skin conditions like eczema, like psoriasis. So it is a real link. And when, you know, I'm sure there are people have said, oh, is it stress? So it's not going to totally be all stress, but definitely I would say that there's a large role for it. So
I mean, as you've explained, you know, it causes inflammation, and you know, and also if cortisol produces more oil, you've got the perfect storm, really, haven't you?
Exactly.
And affecting the skin barrier, then, you know, you can't keep the kind of bacteria out.
Exactly.
They come from external factors.
Exactly. And then again, we talked about a vicious circle earlier, and it just becomes the same thing again, because what happens is, you know, you're feeling stressed, you get some spots, and then you feel even more stressed because you look at the spots and think, oh, I didn't need this on top of everything else that's going on. And then the stress level rises again. So it's hard to start to break that cycle, which is why I talk a lot to my patients about stress management and simple things that you can do in your life, in your day, for you to start to manage stress better. And please, anybody, please do share any tips that you have for stress management that you use in your everyday life. And one of the things that I really like is the use of skincare. So when you're applying your skincare, whatever it may be, that is a time for you to spend with yourself. So even if it is 5 minutes or 10 minutes, that's your sort of your me time, your self-care time. So that's why I encourage people to use that time more effectively. So try to remove the negative thoughts at that time. Try to enjoy the smell of the product that you're using, the texture of the product that you're using, use it effectively. Enjoy that 10 minutes that you have to yourself, or if you're trying to get that, even if it's 1 minute, enjoy that 1 minute, because this can be almost a stress busting activity. Now, treating acne, obviously there are medical treatments. We won't have time to go into all of those today, but what people sometimes forget is that in addition to medical treatments for acne, you do have skincare options that can complement medical treatment. And sometimes you don't need to have medical treatment. It is about skincare, and you can maybe stave off needing to have medical treatment and improve the outcome of your skin. So there are some steps that I think most people should try, and there may be, 5, maybe too many steps for some. So you don't have to do all of these steps, but these are sort of the things that I would recommend most people to do. So the first is to cleanse your face effectively, because you want to remove that congestion. So like I mentioned, acne is oil, pore clogging, and bacteria. When you cleanse your face and you use the right actives in your cleanser, that is what unclogs your pores. So it's sort of starting to remove that forest floor for spots to form on. When that happens, you reduce inflammation anyway. And then even though your cleanser may not be killing bacteria on your skin, it's making the environment less friendly for that bacteria to then form a spot. And it's important to cleanse in the morning. So wash your face in the morning and again in the evening, especially now as we're wearing, I mean, I don't know about you, but I wear a mask all day, every day.
Yeah.
So, I'm
quick. You guys are on the front line in clinics and things. Yeah, I imagine you're really seeing it. When you say cleanse using the right actives, what should people look out for?
So if you are suffering from acne, that means your skin is congested. So you need to look for things that decongest your skin. And one really good ingredient for that are the exfoliating acids, basically, because what they do is they go deep into the pores and they start to remove the dirt and debris out of there. And a good way to use an active in a face wash, the good thing about it is that you're less likely to overuse it, because you're going to wash it off. So you're not going to be too harsh with it. And some of the more popular exfoliating acids that people use are things like alpha hydroxy acids, or AHAs, or BHAs, which is salicylic acid. But for some people, this can be a little bit too harsh for their skin, or they have had a bad experience using them. So we're going to go through the goodie bag products that you have. And one good thing about the Tulpa range is they do have cleansers that contain exfoliating properties, but not AHA. So gentler versions of those that you may be able to tolerate better, or at least they're a good starting point for this.
Sylvia's just saying to combat stress, she lights a candle, has a herbal tea, and goes under a blanket every evening to calm
Brilliant. Brilliant. Yes, I can definitely identify with that. And I've recently been introduced to weighted blankets.
I was going to say, yes, exactly, weighted blanket. We've got 2 of them in the house here. Yeah, my daughter really loves hers. That's so grounding.
I must say, it does give you a very deep sleep. Now, one of the other steps that you can use after cleansing is you can use a toner. And again, this is to unclog those pores, to remove, not necessarily kill bacteria, but again, make that environment unfriendly for bacteria to form a spot. And it also can help with the pH of your skin. So it can restore the natural pH of your skin by using a toner.
And why is that important for acne? Well, for us all to have the right pH on the skin?
Because the bacteria thrives in certain environments, and pH is one of the ingredients that the bacteria needs the right pH or the right acid alkaline environment in order for it to proliferate, in order for it to have a great time, basically. So you want to remove anything that allows the bacteria to enjoy itself and make the environment unfriendly. Toner, I mean, sometimes it's difficult, especially in the morning, if you think, oh God, I'm not going to do 5 things in the morning. I'm not going to do this many things. You can move these things around. You can skip a step here. You maybe use the toner on the weekends and not in the weekdays because you have less time. So there are ways around this. This is not, strictly one step after another if you don't have the time for it. Now, a lot of people with acne, especially because you have this inflammation, your skin can feel dry or it can feel tight, and you may be using medical treatments as well to control your acne, and that can make your skin feel dry as well. So if that is happening, you feel tight after you've washed your face, then that means that you do need a moisturizer. And when you have acne, you use a moisturizer, you don't want to be overly greasy. So you want to use a moisturizer that supports your skin. You want to use a moisturizer that will allow you again, to reduce the production of oil on your skin and mattify and be able to mattify the skin, but be able to hydrate it. So again, we're going to talk about some of these products later and how they let you do that. Now, I always suggest that everybody wear sunscreen. Please let me know if you are those people that are wearing it, even in winter, no matter what the weather is. And I think people with acne get worried about wearing sunscreen because they worry that it's going to make them feel oily or this make their skin look oily. There are lots of lighter formulations. Go out, try a few, try the sample sizes, have a go and see, because it is important. Victoria, do you wear sunscreen?
Every day, yes. Yeah, I'm
Brilliant.
conscious of the blue light as well, because I'm in front of a screen all day, so that I know SPF has a degree of blue light filter as well. Yes,
Absolutely.
I wear it all the time. Just
Brilliant.
going back to cleansing, we've got a question about double cleansing, perhaps with an oil cleanser to remove makeup first. Is that bad for the skin? So it might be, is double cleansing bad for the skin, or is an oil cleanser?
So I'll answer both. So double cleansing is not bad for the skin, because if you're doing it in the evening, it's actually pretty essential if you've been wearing makeup or tinted moisturizer or whatever during the day. So I normally recommend that you try you remove your makeup with a micellar water, and then you use your face wash / cleanser. In the morning, you may not need to double cleanse, but if you like the feel of it, fine. Oil cleansers, I don't have a problem with them. I don't think they're bad. The only thing is that when you have acne, your skin is already probably overproducing oil, and then you're adding one in. But the good thing about using an oil cleanser in a way is that at least you're washing it away. So I know that some people will say, well, I love that oil cleanser because it removes all my makeup, or it does everything for me. It takes everything away. It makes my skin feel really clean. You can use them to remove makeup if you want to, but just make sure you wash them off really, really effectively, and then cleanse again over that, because you don't want the oil to be left behind and aggravate acne. And at nighttime, again, I sort of think that your skincare routine, your evening skincare routine, should start when you get in. So get in, wash your face, especially if you're wearing a face mask during the day, and then you can start your evening skincare regime. So if you use a serum, you can start using it then, and you can slowly layer the products over the evening. For me, that's the best way, because having to use 5 or 6 products just before I go to sleep is not going to work for me, because I'll in 15 minutes you're trying to cram everything in. So start things as soon as you get in, and also remember that getting the right amount of sleep is extremely important, because lack of sleep or sleep deprivation is translated by your body as stress. Exactly. And also when you're asleep, the way that your blood is flowing to and from your skin changes, your cortisol levels change, and it's the time for regeneration. So all the damage that's gone on during the day from from UV, from pollution, at night is where your body will repair that time. So do remember, sleep is extremely important.
And when we're talking about sleep, how often do you need to change your pillowcases and things? Do you need to 60-degree wash them?
I've read lots of things about this, and the optimum time to change seems every week. But I have heard also 3 days, so anywhere between 3 days and 1 week. And although a pillowcase will not necessarily cause acne, it can aggravate your skin. That's one thing if you have an inflammatory skin problem, because we all have microbes that live on our skin, and then they get transferred onto the pillow. We also have stuff on our hair, your product, and then microbes on your hair and on your scalp, and that gets transferred onto the pillow. There are some very specific forms of acne that are caused by mites that live on all of our skin and in our pillows. So I'm sorry to inform you. So it is important to wash them, and wash them effectively, and change them regularly. And also, I do feel that a lot of people are correctly asking these questions, like, what else can I do apart from the skincare? What else can I do? And I think people do feel a little bit guilty about, have I changed my pillowcase enough? So if it makes you feel better to change it every 3 days, and it's not too taxing for you, that's fine. It's not going to do any damage.
Yeah, we've got a couple of questions about specific lumps and acne on the chin, but maybe we'll tackle them when you come to the end of your routine.
Definitely, definitely. Couple of other things that I quite like doing and I quite like suggesting is if you do like face masks or you're thinking about like doing the things at home, a little bit indulgent things, then a gentle face peel or a mask once or twice a week is a great idea, especially if you've got some problem areas. So lots of people will say my T-zone is an issue, it's quite oily. So a couple of times a week, a face mask or a gentle face scrub are good ideas to incorporate into your skincare regime. And please do let us know if you're already doing these things.
Yeah, let us know if you've got any tips that you found work for acne prone skin, or anything that you've come across. Maybe some tools or masks, you know, the LED masks or the blue ones.
Yeah, very popular, very popular. I hear about these a lot. So I'm just going to pause the share now so that we can, so everybody hopefully has got their goodie bags.
Yeah, if you haven't, they are on their way. So if you signed up last week, I think hopefully you've got them. And has anyone had a chance to try them? Any favorites? Anything you've got questions about? Please put them in the chat. Alia, do you want to tackle the question from Isa? I'm 36 and very often I have acne on my chin. What might be the reason? We sort of talked a bit about the hormonal. Does it mean it's hormonal, or could it be lots of things?
It's one of the signs. So if you should meant 36, yeah. So adult female acne especially occurs in the chin area, around the jawline. Another type of acne that you can get in this specific area is something called a perioral dermatitis. So it can be confused with regular acne. Treatments are similar. And there are some overlapping treatments. And again, it's to do with the concentration of the oil producing glands and what they're activated by. So hormones are usually activating the ones that are in the central portion of the face. And that's why you tend to get spots in those areas. Of course, maskne and all the rest are options, but I'm guessing this has been going on for some time.
And the perioral dermatitis, what might cause that?
It's an inflammatory skin condition. It doesn't pick who it's going to happen to. It can be for a number of reasons, and we treat it similarly to acne. So it does involve using the right skincare, also involves using antibiotics in some cases, and we do also use other active ingredients that we would need to prescribe, things like azelaic acid. So it's worth, if you're having persistent spots, especially in this area, and you're having redness or flaking in that area, just to have it checked to see if you may be in between a couple of diagnoses. You may think it's acne and it could be something else. So it's worth getting that checked out.
And Sarah's asking, and I do sympathize with you, Sarah, that I get this too, lumps under the skin that come up, never seem to kind of quite come out, then go away and then come up again.
Yeah.
The next month.
These are usually signs of skin congestion. So what I recommend in those instances is, yes, try not to press them, because you will probably leave a blemish if you press too hard, and sometimes nothing comes out. So it's usually basically like having a blocked pore or just oil building up underneath the skin, and then it just regresses itself when the inflammation goes down. The best thing to do is to incorporate exfoliant containing products into your skincare regime to try and reduce that congestion.
If the congestion this is what I always struggle to understand. The congestion, it feels like it's happening, far out of your reach, like it's nothing that you put on the surface will affect it.
So if it's really deep, like if it's a nodule, so if it's bigger than 3 or 5 millimeters, if it's bigger than that, then it's a nodule. And then probably that does need to have more targeted treatment. And sometimes, yes, oral treatment may help. But if it just happens the odd time, then again, it is a sign of inflammation. You probably can't see it, but there is usually a little punctum somewhere that's allowing this problem to happen. So that's why I favor decongesting in these situations, but I don't favor if you push long enough, something may come out, but I don't want anyone to try that.
I know, I've been left with some right old battle scars here from exactly that. Isa's tried the 3 enzyme peeling, which is I think it's a cult product, isn't it?
Yeah, I've got it. Hang on, I've got it here. I've got my little sample here. Even I've tried this and I really liked it. So it's quite gentle. So it's called I don't want people to don't get put off by the fact that it says peel on there, and think that it's really, really strong, because it does contain exfoliating acids, but they're fruit based. So they've used papaya and they've used pineapple, which is what is on the front here. And they have shown to reduce oil secretion. And that's what you want when you've got acne prone skin. It's very comfortable to use, and I like to use it just before I have a bath, actually. So I'll have cleansed my face, I'll put this on, jump in the bath for 10 minutes, and then take it off when I'm out.
I think that an enzyme peel works in a slightly different way to an acid peel, that it might be a bit less sort of invasive.
Yeah, they tend to be better tolerated. So it's the enzymes are what are exfoliating your skin. You're not having to use anything physical. So there's no physical beads or whatever in there that you would physically rub into your skin. And it is particularly helpful for those people who are sensitive to the other acids that we see a lot in skincare, which is glycolic acid, salicylic acid. What else have we got in the goodie bag, actually? Yes, so we talked about cleansing. So I've got the 2 cleansers here. So we've got the 3 enzyme cleanser, and like we've just talked about the peel. So it's got the fruit enzymes in there. So these are derived from pineapple, like I said, and papaya. It is really good to control oil production by the skin. And also, if you're worried about using active exfoliating acids on your face, it's a great way to start using them. And as far as I can remember, it smells quite good. Yes, it does. Really fresh feeling afterwards as well when you've used it. And actually, I can say that I've got some young teenage cousins who I've been able to share some of these products with, and they've given me some brilliant feedback, because teenage years, as you know, are sometimes quite stressful anyway. And especially with what they've been going through with the exams and school and all the rest, it's been really helpful. Now, the other cleanser is also from the acne range. It's the CBO Max Effect Cleanser. Now, this one has actually, when you use it, it has got little particles in it, which you can just feel. So some people really like to be able to feel that they're doing something really actively on their skin, which is fine. Just don't over rub, don't be over strenuous when you're using this on your face. And it gives it's got camphor. So it's got this almost minty slight heat to it when you put it on. And you don't have to use it every day. If you're worried to use something that's got particles in it every day, you can maybe use it once or twice a week, and especially in the areas where you think you produce the most oil, usually in the T-zone area. So I think that's another product that is a good one to have in your goodie bag, because you're very likely to use it. We've also got the toner. So again, based on the 3 enzyme combination, and again, mainly to resurface the skin and to reduce oil and restore the skin's natural pH. So we're trying to remove any acne friendly environment and make the environment unfriendly for acne or for spots.
While we're on that subject, there's a question about probiotics for the skin, and while we're talking about making environment friendly or unfriendly for bacteria, I guess we want to promote the good bacteria on our skin.
Absolutely.
How can we do that?
So now you can, I mean, it will be I do quite like probiotics, and the reason is that there is a link between, we've talked about the link between the brain and the skin, and there's also a link between the gut, the brain, and the skin. So what we know is internal inflammation can basically be expressed on the skin. So I actually quite like probiotic, looking at probiotic in your diet, and you don't have to go and buy supplements for that. Just having a balanced diet with a good amount of fiber, and trying some of these the more fermented, anything that starts with a K, basically it has got probiotics. So kefir, kombucha, and there's kimchi.
Krispy Kremes, do they?
Why not? So these
I know what you mean.
Are helpful, and I think they're things that we should all be incorporating into our lifestyle and into our diet to protect ourselves. You can also get probiotics in skincare, but the jury is out as to the helpfulness of all of these things. We do know that in inflammatory conditions, acne, eczema, psoriasis, the gut-brain skin axis does seem to be having some form of effect. So moderating that, so moderating gut inflammation, seems to have a positive effect on the skin in some certain skin conditions, but we still need to know more about that going forward. But having probiotics in your diet is good for you anyway, so why not? It's a good way to, you know, replenish your own gut microbiome.
Yeah, my son, both my children had eczema when they were little, and I took them off dairy. And then actually, there is a question about dairy, which we'll come to, because my mum used to be aggravated by dairy, and then I kind of took my eye off the ball for a bit, and my son started piling in the yogurt, plain yogurt, and his eczema cleared up. I mean, I know some people say their eczema and dairy don't mix, but I'm convinced it's to do with the probiotics, because I was making my own yogurt. Probiotics that he was eating in his diet that helped clear up his skin.
Brilliant. Anything, and especially if you're doing it at home, so you're not having to spend loads of money to go out and do and you know, replenish your diet or your cupboards with things, you know, the things that you can do at home that are the easiest, that's the best way forward.
While we're on that subject, sorry, can we just tackle the dairy?
Yes, sure, go ahead. What was the question?
So Katie's asking, some people say dairy triggers their acne. Do you know if there's any evidence for this?
There isn't any robust evidence. So what we know is that when we've looked at people's diet and acne, there seems to be a little bit more acne in those people who have a Western diet, but we're not quite sure why. It could still be based on those people's genetics. It could still be based on the environmental pollutants that they are in contact with, for example. What we know about dairy specifically is that there were some studies that looked at milk and acne. And what they showed actually is that skimmed milk, people that were drinking the skimmed milk, their acne scores were higher. And the reason for that is that skimmed milk has a higher glycemic index than semi-skimmed or full fat milk. So actually, we wonder now if it's not actually dairy. We're wondering if, in fact, it was the glycemic index. So basically, all the things that you know we're not supposed to eat, the refined sugars, the Krispy Kremes, you know, these are the things that we should be having in moderation, aiming for a balanced diet.
So a higher fat milk would have a lower glycemic index because it's less of a sugar spike.
Exactly. So there's no robust link, basically. That's what I'm saying. If some people, though, I do find lots of people will come and say, look, I've cut dairy out, and I say that's okay. If it makes you feel better and you can see some positive effect, that's absolutely fine. The only thing I don't want people to do is to cut multiple food groups out at the same time and then risk becoming nutrient deficient themselves.
Yeah, absolutely. Good advice. Thank you. There's also a question about the toner.
Yes.
How should you use the toner? Just with your hands or a cotton pad? Laura from Top has replied, on a cotton pad, sweep across the face after cleansing.
That's exactly right.
Pat it.
Did you pat it in?
Well, because I've stopped using cotton pads, so I've tried.
I think you can use the reusable ones as well, but it probably soaks up a lot.
Mine are quite big and fat like that, so I tend to pat it in. So
fine, that sounds great. What else have we got in the goodie bag? Let me look at what I've got here. Yes, the pore constricting concentrate. So this again is probably for those areas where you feel that you have most congestion. So we've had a lot of questions about the chin area. You can put it there. You can also put it on the T-zone. You can put it all over your face. And again, reducing the size of the pores. I mean, it says pore constricting, but what we're really trying to say as well is to make sure that the pores are not so big that lots of things are getting in and then causing a spot. So again, we're just trying to make that environment unfriendly. And the more that you use products like this, the more that you cleanse those pores out, the more that you unclog your skin, the less likely you are to have acne form. We also have, let me just bring these up. Some of the moisturizers. So there's basically 3 creams in your packs, and they all do slightly different things. So you don't need to use all of them. You probably only, and what you could do is you could maybe use some on certain days and some on other days. So the anti-blackhead enzymatic cream is exactly what it says. It's supposed to be anti-blackhead. It's supposed to mattify the area that you apply it on. And I think this is really great for teens as well, you know, because it's easy to use. It's quick. You know, you wash your face in the morning with a face wash. If you want to use a toner, great. If you don't want to use it, you pop this on. It keeps your skin mattified for the duration of the day, and also it will reduce the amount of blackheads that you have. And I find that teens and younger, you know, when you're almost even around the age of maybe 11 or 12, they're starting to say, oh, well, I can see some pores here and they look a little bit like blackheads here. So it's worth starting to do that. And again, you don't have to use it every day. We talked about skin feeling dry when you have acne or skin, especially if you're maybe on treatment, and also just because of the inflammation. So you don't want something too greasy. So the normalizing moisturizing cream again is normalizing the environment. So it's making it unfriendly for bacteria to cause a spot. And also it's not allowing you, for example, to get too oily. I think that's one of the most important things, mustn't get too oily. And also this is nice to start to reduce. We all have a few imperfections here and there. It's normal, but if it bothers you, then this is something that can start to reduce the appearance of those. And then we also have the correcting cream. Now this is a brilliant product, especially for the adult female acnes, or even if you're an adult male watching, the Cica Plus. The CBO Plus Cica Correcting Cream, because this contains a number of brilliant ingredients for acne. It's got salicylic acid in there, which we know is good for acne. It's also got it's also got almost like a patented or a trademarked ingredient, which is there to reduce sebum production. And all of the products, we will have time, I hope, contain the tulpa peat, which is a powerful antioxidant. So this is for overnight. And what I would do for this one is I would use it, especially if you're getting spots in the U zone, so around the jawline, I would use this at nighttime. You can use it up to every day, but even if you want to use it a few times a week, that's completely fine. And actually the normalizing cream that I talked about before, this is for nighttime as well.
Yeah. And this Cica is that Centella asiatica? Is that the calming tiger grass, I think?
This is, I don't want to say the wrong thing. I will come back to that one.
Yeah. I'll see if I can find it on the. Here we go. I'll find it. I love that one. I think this is really. This is better for my. I think the others are better for my teens. This is better for me. I think this.
Yeah. I mean, it contains, like I said, it's got salicylic acid. It's got an oil controlling complex, and it's also got zinc in there, which I think all of these are great. Now, the other thing in the goodie bag is the silver face mask. Now this has a little bit of it has a nicer entertainment factor to it, because when you put it on, it does actually look slightly silver. Like you do get a bit of a pearly look when you put it on. And again, it's suitable for acne skin. So if you have active acne spots, it's completely fine to use it, because people worry that it's not safe to use, for example, or mask. Can I use a mask when I have active acne? Yeah, you can just see it there, can't you? So you can use this a few times a week, and it's there to reduce those acne spots and to really cleanse your skin effectively and deeply.
Loads of options. So that we do have a couple of questions about switching up your skincare. Obviously we've got lots of options. Should you switch in depending on how your skin is feeling on the day, mix and matching between ranges, or should you how long should you stick with one regime to see if it's working?
Actually, I do favor switching up your skincare. And the good thing about this range, as an example, is that you can, use product from one sub range and another sub range. It doesn't matter. They don't normally, they're not there to fight each other out, for example. So yes, I think it's really important to do what your skin feels like on the day. So some days your skin will feel more oily, so you want to maybe add in that extra step. Oh, I don't use a toner every day, but today I feel quite oily, so I'll use the toner today. Sometimes your skin will feel a little bit more dry, so you think, right, so tonight I'm going to make sure that I used a night cream. Otherwise, normally I don't use a night cream, for example. So making those choices depending on what you've got. And people will have good days and bad days over a weekend. If you think, or in an evening, you think, yes, I'm feeling like I'm starting to get more spots than usual, why not try the mask that day? Again, you can mix and match these products as you see fit and use them as often as you need to. And you can scale back and you can scale up depending on what the skin problem is. But definitely, if you have the time and you're willing to, then yes, switching things is completely fine. I favor that, in fact.
Brilliant. And Amanda's saying, can she use them on her chest and back? Because obviously those are places where you'd get spots.
Sure. So probably Laura might be able to answer if there are any trials when they were making these products on those areas. I can't think of a reason why not. However, just remember a lot of the acne focused products will be looking at oil regulation, and the number of oil glands that you have on your chest will vary from your face. So how much positive benefit you're going to get, I'm not entirely sure, but there's no reason.
A less oily area, isn't it?
Exactly, yeah.
So it might be oilier.
Exactly. And also another thing that is important to remember, if you're, for example, using one of these tubes on your back, it'll run out very quickly. So they're not necessarily designed for that sort of use, but it's a good point.
Yeah. Jane is asking, how often do you recommend changing your skin coating? I know we've talked about your kind of switching up, but she says her skin seems to get used to certain actives and they stop becoming effective. Is that a thing?
I do hear this a lot, and sometimes it's just that your skin has now is now tolerating the active much better than it was. So it doesn't necessarily mean you have to drop it. Your skin turns over every month. So I normally say to people, if you're going to try something, try it for a month. The best time for me to know if it's working will take up to 3 months. So if after 3 months you think, well, this is not really working for me anymore, or it was working really well in the beginning, but now my spots are coming back, then yes, it's time to make a change. Or maybe even and go up a step, maybe. So, you know, you're very tolerant to this now. Let's try a stronger exfoliating acid, for example. Also, when the seasons change, I think, you know, sometimes when it's warm, people tend to scale back a little bit on their skincare. When it's cold and you've got the heating on, then your skin is more dry, so you need to add a little bit more moisture into your skin. So these are also seasonal changes I think are really important for people to remember.
Especially as we're coming into winter, we lose moisture, don't we? So I suppose with acne prone skin, you might be reluctant to put anything kind of a bit heavier on your skin.
And that is why if you can look for textures, so use serums. Serums are great because they soak into the skin quickly. Also think about using more gel creams rather than rich creams. If you're going to use a rich cream, maybe use it at night and just let it do its work. And that's why if you have acne and you want a richer cream for a little bit more moisture, but you also want to make sure you're not aggravating your acne, then I think the Cica correcting cream is probably a good option in that particular situation. Shall we very quickly go back to the final few slides?
If everyone's happy to stay on, I mean, we said we'd finish up about 15:15, but if you're all happy to keep posting questions, and Alia's just got a final couple of things to say, but if you do have more questions, obviously really happy to take them.
Yeah, absolutely, please keep them coming. That's completely fine. I'm just going to actually get rid of it. Can you see my screen now?
Yeah, I think you need to put it on slideshow.
There we go.
Yep, perfect.
Showing as it should be, brilliant. So we've talked about the goodie bag, and I hope that was a good explanation. But obviously, all the products, their boxes also have all the relevant instructions on there. Just very quickly about, why is this? What is Tolpa? Because as we mentioned, it's already really popular in Poland, but we hadn't really heard about it that much in the UK, and people are very excited about it making its way here. So the Tolpa products all contain peat, and it's a powerful antioxidant. And what we know about antioxidants is that they have a host of benefits. So they're helpful in repairing your skin from the damage that's incurred during the day, for example, from UV. They can also help with inflammation, which is implicated in acne. So these are things that antioxidants are things that people are looking for in products now. Obviously, peat is a natural ingredient, and I mentioned before that people feel there seems to be a little bit more of a shift towards looking for natural ingredients and the properties that are available in our own environment. So I think that's a great thing about this range. And obviously, these products have been tested for their effectiveness and safety, and very vigorously tested, in fact. So they're scientifically proven, and it's that cross between, it's that nice space between science and nature, and that is what Tolpa is trying to showcase with their products. So we've already mentioned they're safe, we've got proven effectiveness, and they are quite comfortable to use. I can say that because I've used everything that's in the goodie bag today and more.
Yeah, yeah.
There are obviously everybody's going to have got a selection of things that you may not have got every single product in the ranges. And what you need to know in the acne ranges, there are sub ranges. And in the beginning, when I talked about different types of acne, so mild, moderate and severe. So when you're looking at the ranges and deciding what may fit your skin, if you have a more mild acne, then the 3 enzyme range is great. If you have a looking more towards getting a little bit between mild and moderate, the normalizing range is probably for you. And then the max effect and the CBO plus range, the Seeker range, is for the more persistent and recurrent acne. So it's all, it's color coded here for you. But what it shows is that the range is inclusive of all types and all grades of acne, which I think is positive. And you can mix and match between the sub ranges as well.
Brilliant.
So we've answered some questions already. I'll stop sharing. And Laura will just post up how to find Tolpa on Instagram, but I would love to be able to take any more questions if there are any.
Oh, well, thank you. I think I hope I've covered everyone's questions that put them in the chat. Thank you for being such an engaged and inquisitive audience. If anyone has any final questions, please feel free to ask them. Meanwhile, that's been really really interesting, Alia. It's a problem that's only we're going to see more of, I think, aren't we? I was just reading the papers over the past week about especially, the teenage anxiety and how that's affecting people's skin, and maskne and pollution, as you say, the damage that can be done to our skin barrier. And it's great to see that there are sort of natural proven solutions as well that are quite accessible.
Yeah, exactly. And I think, people are much more interested, which is showing already from our class today, our masterclass, that people are interested in really making their skincare work for them. So I think gone are the days where you just pick up whatever your friend is using or your parent is using. You want to use things that are right for your skin. And I think that's, inquisitive is exactly the right word to use. It's looking at what's available and what suits the problem that you have and really targeting your skincare. And luckily, there are products available at lots of price points that people can start to engage with.
Yeah, perfect. Thank you so much. Thank you everyone who joined us. We will be sending you the recording of this tomorrow if you missed anything and want to catch up. Meanwhile, thank you, Alia. Thank you, Tolpa, and enjoy your products. Please do let us know. You can find Get the Gloss on Instagram. You can find Tolpa on Instagram. Let us know how you're getting on.
Thanks, everyone.
Thank you. Thanks everyone for joining.